My name is Giuseppe Micali. I am professor of dermatology at the University of Catania in Italy. Catania is on an island, Sicily, which is in the south part of Italy. And the university dates back to the 15th century, before America was founded. Cosmetics, per se, they shouldn't have any active part. It means that they should just make the skin more soft or more appealing. Now cosmetics have elevated their target. Now there are cosmeceuticals, so there are cosmetics who have some therapeutic effectiveness, and they are called cosmeceutics. We have also today, we discuss about these moisturizers, which originally, 20 years ago, was only petrolatum. It was greasy and was badly accepted by the patient or by the parents who have to spread all of this greasy substance on their baby. Now we are cosmetics, so cosmetic emollients plus, which are very easy to spread, and they have also technology, special technology. That's again, research is very important for the development. Who penetrate and who are based on the same substance that are lacking on the skin of these patients. So we have kids with atopic dermatitis, which they have a skin defective of ceramide. So we have product that contain the missing ceramide incorporated in a special device who is able to release over time the same quantity of ceramide, and so to guarantee for a long time a moisturizing effect. But there are also many other aspects of dermatology which are enjoying, I would say, enjoying this renaissance. For instance, cosmetic dermatology, aesthetic dermatology. Now we have, for instance, some substance, like a drop of a substance that could be injected in the skin, and then once it passes the epidermis, it goes into the dermis, and excuse me for the word, but it explodes in thousands of little particles which cover. So one drop of product, which is called a skin booster, explodes in the skin and reach an area which is much superior of the area that a drop can cover, a single drop. But because it explodes in thousands of parts, so this could benefit a large area of skin. Then we have all of this laser, new laser. So 20 years ago, we have only one or two types of laser. Now we have laser of many, many types, could be ablative, could be non-ablative, and are able to, without pain, to cure or to make disappear many cosmetic problems, many spots, many growth on the skin, without doing any type of surgery or without to do any probably not effective topical treatment. In my opinion, research and development is essential for any medical discipline, in particular dermatology. Once, because the skin is easy accessible, and also many imaging or many laboratory tests can be performed in vivo on top of the one that can be done in vitro. So research has brought a lot of great information for the development of new drugs. Right now, there's like a renaissance in dermatology because research has finally provided the data that we were expecting for, which include the identification of specific target that should be taken into consideration when developing a new drug. So before, in the past 30 years, 40 years, we have only a few drugs, systemic drugs, effective for all type of skin disorders. Corticosteroid, immunosuppressant, and that's it. Cyclosporin, immunosuppressant, was one of the latest, but for 20 or 25 years, that's what we had. Now, finally the research has discovered some target cells, some target substances that are released by cells, and those could be the main objective for developing new treatment. So now we have biologic agents that are useful in a variety of dermatologic disorders, serious dermatologic disorders. We have now immunologic therapy, let's say for melanoma. We have JAK inhibitors, another type of drugs, which are oral rather than being by injection. And so which are effective for alopecia areata. We are treating patients that for 20 years they did not have a hair, and they're regrowing. Now we are experiencing new treatment for vitiligo. The same concept is applied also to cosmetology. Today we're talking about skincare, which originally was thought to be just for cosmetic purposes. It's not true. Now the research has found out that the skin, the damaged skin, could be the portal of entry of many substances. That could be pollution, that could be toxic substances, that could be any type of external aptents, we call. If we go through the skin, this may trigger a reaction that could be an immunological response, that could be the first step of developing in a certain type of patient individuals, atopic dermatitis, psoriasis, and so forth. So the development in this field have demonstrated that if you moisturize the skin properly with the right product, then you will be able to curb all of this penetration of substance that may cause reactions. I have a personal point of view which of course can be also source of debate or whatever. I think that it's very important the collaboration between physicians, all the dermatologists, and the industry. To be honest, I don't think that without the help of the industry who invested in research and development, all of these drugs that cost hundreds of millions of dollars, I'm sure that there are no university in the world or a consortium of university that can afford so many billions of dollars invested in research. But we have to be clear. Dermatologists has to collaborate in developing new drugs or developing new insight in skin biology, in skin physiology, and so forth. But this means that there should be a partnership. Means that the drug company has to have an honest relationship without charging, because all of these biological agents are so expensive. And sometimes for many countries, it's difficult to afford such costs for healthcare. So it is important to make things clear, establish a partnership, a collaboration. At the same time, it shouldn't be so profitable for the industry. They should also come, and they should also think in the interest of patients who, especially if you come from certain country, they cannot afford such drugs that can change their life.